March is National Colorectal Cancer Awareness Month. According to the Centers for Disease Control and Prevention of cancers that affect both men and women, colorectal cancer is the second leading cause of cancer-related death in the United States and the third most common cancer in men and women. In 2011, over 141,000 people in the United States were diagnosed with colorectal cancer, 90% of whom were 50 years of age or older. It's estimated that as many as 60% of all colorectal cancer deaths could be prevented if all men and women aged 50 and older were routinely screened. Dr. Lily Tran of Advanced Gastroenterology and Surgical Associates dispels the myths about colonoscopy screening and explains that in most cases, colorectal cancer develops from precancerous polyps in the colon or rectum.
Colonoscopies are very, very important. First, right off the bat, why? Is because it's very important for being able to detect malignancy. That's the most important thing, and colon cancer is very preventable if we are able to diagnose it before it gets there. And it just so happens that a person does have colon cancer if it's small enough and has not spread, and is treatable by surgery. For screening for a Caucasian, so white, a population without knowing anything about the family history, it is recommended in the United States to be, first colonoscopy should be at 50 years of age. In Black Americans or African Americans, it is actually recommended to have first colonoscopy at the age of 45. Now, let's say that a first-degree relative, so mom, dad, brother, sister, who have been diagnosed with colon cancer, then the relative will need a colonoscopy 5 years prior to the age of diagnosis of the person with the condition. If you go back and you listen to folks who have gone through the prep on the day of the procedure, and I always talk to patients, well, how was your bowel prep, and did you have nausea? Oh, it wasn't so bad. Bowel preps today, the ones that we use for our office, is actually odorless, tasteless, and gritless. So essentially, the folks will taste the drink, the flavor of the drink that they put into. So it is not as bad.
We've shared this with you before, but it's worth sharing again, a little poetic reminder about the importance of colorectal screening.
I see the moon, and the moon sees me. My moon now is over 50, unbelievably. If there's a polyp, trouble there could be. Better see the doctor of gastroenterology.
For more information on colonoscopies, as well as other treatments and surgical procedures available at AGSA, please click the Colon Cancer Screening Story link on our homepage, yourhometownhealth.com.